Presenting Senate Bill 458, which is a bill that prohibits any locality, institution of higher education, employer, school board, division superintendent, school principal, or private school from adopting, implementing, or enforcing any policy, rule, or order related to COVID-19 that requires individuals to wear a mask. Madam Chairman, I would like to read to you all an excerpt from Marjorie Smelkinson. She's an infectious disease scientist whose research has focused on influenza and SARS COVID-19. And the question was posed to them: do the harmful effects of masking children outweigh the benefits of wearing a mask? And in the first point, it says, imposing on millions of children an intervention that provides little discernible benefit on the grounds that we do not have yet gathered solid evidence of its negative effects, violating the most basic tenets of medicine, which is first to do no harm. Continued mandatory masking of children in schools, especially now that most school-age children are eligible for vaccination, fails this test. Madam Chairman, the second point that was made, that was many countries like UK, Sweden, Norway, and others follow the World Health Organization guidelines, which recommend against masking children ages 5 and younger because A, this group is at low risk of illness, B, masking is not in the overall interest of the child, and C, many children are unable to wear masks properly, even for children aged 6 to 11. The WHO does not routinely recommend masks because of the potential impact of wearing a mask on learning and social development. The WHO also explicitly counsels against masking children during physical activities, including running and jumping at the playground, so as not to compromise breathing. I want to talk to you a little bit about a couple of studies that I would like to bring to your attention. One of those is a Brown University study where they were analyzing 2020-2021 data from schools in New York, Massachusetts, and Florida, and they found no correlation between student cases and mask mandates. In Tennessee, there were 2 neighboring counties with similar vaccination rates. It was Davidson and Williamson, and they have virtually overlapping case rate trends at their counties in their school-age populations, despite one having a mask mandate and another one having a mask opt-out rate of about 23%. Now, one would expect a quarter of the students opting out of masking to affect the transmission rates if masks played a significant role in controlling COVID-19 spread, but actually that was not the case. In another recent analysis of data from Cass County, North Dakota, comparing school districts with and without mask mandates, concluded that mask optional districts had lower prevalence of COVID-19 cases among students this fall. And then again in Alachua County, Florida, they suggest no differences in mask required versus mask optional schools. And then similarly in the UK, recently reported finding no statistically significant differences in absences traced to COVID-19 between secondary schools and mask mandates and those without mandates. Her third point, Madam Chairman, is the concern for the mental and socio-emotional outcomes are hard to observe and measure and can take years to manifest. So there were a couple of studies found in Greece and Italy. They found evidence that masking is a barrier to speech recognition, hearing, and communication, and that masks impede children's ability to decode facial expressions, dampening children's perceived trustworthiness of faces. Research has also suggested that hearing impaired children have difficulty discerning individual sounds. Opaque masks, of course, prevent lip reading. And it's interesting, as I was heading over to the Capitol today, I even spoke with one mom who said that they've noticed an increased risk with their child's dental cavities as a result of wearing the mask. Madam Chairman, I've done a lot of research in looking at the Department of Health's website numbers, and as of March 15th, 2020 to January 22nd, 22, there have been a total of 207,559 cases. and these are all children 17 and under. That's a lot of cases. Of those cases, 1,176 kids were hospitalized. That's 0.56% of the diagnosis, and then 13 deaths, which if you round that to a percentage, that means 0% associated with children under the age of 17. And yet, the children under the age of 17 are being forced to wear a cloth or disposable surgical mask, which even the manufacturer says right on the box of disposable masks that these masks do not prevent the spread of viruses like COVID. I remember back whenever in the fall when kids were heading back to school, I picked up a box of masks and I couldn't believe it. That's exactly what it said on the box. So why are we forcing kids to wear a mask when the risk is so low that they will be hospitalized or even die from COVID? These paper and cloth masks don't work, and they are actually making individuals, including children, sick by forcing them to breathe in their own carbon dioxide, decreasing oxygen levels, and creating a warm, moist environment on their face, which is actually leading to even dermatology type rashes. It's conducive to breeding fungi, bacteria, virus, and disease. This practice is actually suppressing our kids' immune system and making them sick. Not only is this making our kids physically sick, but it is creating a mental health crisis among our youth, which is leading to feelings of isolation, depression, and even suicide as kids feel hopeless and afraid. It is unethical and unconstitutional to force healthy citizens to abide by measures that can result in physical and emotional harm and that infringe on the ability to move freely throughout society without discrimination. And yet public schools across Virginia, like Fairfax and Loudoun County public schools, are depriving children of an education and even threatening suspension from school if they do not wear a mask. Madam Chairman, our parents need relief. Our kids need relief. Our kids belong to us and not the school systems. Parents are being charged criminally for truancy if their children do not show up to school with a mask on, reinforcing the message that they believe our kids belong to the government and the government knows best, despite Governor Youngkin's most recent Executive Order 2 that went into effect on Monday, January the 24th, giving parents the ability to opt their student out of wearing masks. For those with deeply held religious beliefs, mask mandates violate their ability to abide by natural law and follow their convictions to walk in faith and not fear. As such, the decision to wear a mask is a highly personal one and should not be universally mandated. Measures that are meant to protect the community as a whole are ineffective if they hurt individuals in that community. Wearing masks for long periods of time can adversely affect your health. Wearing a mask for long periods can cause pulmonary fibrosis, as loose fibers are seen on all types of masks and may be inhaled, causing serious lung damage. There is a risk that viruses and bacteria may actually accumulate in the fabric of a mask, thereby increasing the amount of virus being inhaled. The masks are actually making people sick. Masks collect fungi, bacteria, viruses, and because of the moist air exhaled, masks are an excellent breeding ground. People who wear masks are breathing in their own carbon dioxide. With every breath you are breathing out or exhaling carbon dioxide and breathing right back in that carbon dioxide that is trapped behind the mask. A mask can reduce blood oxygenation by up to 20%, leading to a possible loss of consciousness. At least one road crash has been blamed on a driver wearing a mask. Police reported that the driver of a single car crash in New Jersey is believed to have passed out behind the wheel after wearing a mask for too long. On the same day the CDC's natural immunity report was released, the UK dropped a report of its own. New UK reports back up CDC findings on natural immunity, delivering major blows to school masks, saying that school-age children who never wear a mask had a lower chance of testing positive for COVID than those who always wear them. One study of health workers wearing masks showed that a third developed headaches requiring painkillers, Another study showed that 81% developed headaches and their work was affected. A second study of 53 surgeons showed that there was statistically significant falls in blood oxygen levels after a mask had been worn for a few hours. Research published in June 2020 suggests that the reduction in blood oxygen and the increase in carbon dioxide resulting from mask wearing causes a strain on the heart and the kidneys, and that mask wearers are more likely to develop infection than non-mask wearers. This may be due to the fact that masks reduce blood oxygen levels and adversely affect natural immunity. It is likely that anyone who wears a face mask for long periods of time will have a damaged immune system and be more susceptible to infection. Studies have shown that hypoxia can inhibit immune cells used to fight viral infections. Wearing a mask may make the wearer more likely to develop an infection, and if an infection develops, it is likely to be worse. Masks can also cause hypercapnia or increased carbon dioxide. Symptoms of hypercapnia include drowsiness, dizziness, and fatigue. In conclusion, Madam Chairman, parents should not have to choose between forcing their child to wear a mask in order to get an education and endangering their child's physical and mental health and well-being. It's not even like the masks are working, in fact, they're not. Hardworking Virginians shouldn't be forced to wear a mask all day either or lose their job and means to provide for their family. Once again, it's not even like the masks are working, in fact, they're not. Businesses should not be forced by the government to mandate and enforce a mask policy or deny entry or goods and services to an individual who cannot or chooses not to wear a mask and shouldn't be required to give a reason for not doing so. Universal masking is not preventing the spread of COVID. It is actually causing unintended negative health consequences. Three more points and I'm done. We're losing more children to suicide, mental health issues, suppressed immune systems, hypercapnia, hypoxia, and pulmonary fibrosis than we are to COVID itself. The numbers, the science says it all. Please stop the mandates. The science doesn't support it. Thank you, Madam Chair.
Thank you, Senator Chase. Are there questions to Senator Chase?
I have one,
Senator Cosgrove.
Hey, Senator Chase, you said you don't think businesses should be mandated to forced to have their employees wearing masks, but is it really the state's business to interfere in private business matters?
I believe just as we should not be discriminating against people based on the color of skin or religion or any of those things, that we should not be discriminating against people who cannot or choose not to wear a mask. I think it's an individual and a personal choice, and we should leave that up to the individual.
Thank you.
Any questions? I have a question.
Yes, ma'am.
Much of your discussion had to do with children.
Yes.
And the impact that mask wearing had on children. Yet your bill addresses, you didn't talk about businesses until the end.
Yes.
And but your bill addresses institutions of higher education, it addresses employers, it addresses school boards, it addresses private schools, school principals, superintendents, and pretty much everybody.
Yes, ma'am.
So it will impose this prohibition on all of these entities.
Madam Chairman, it's my desire that we not discriminate against anybody who chooses not to wear a mask. We should respect everybody's decision. If you wear a mask, I respect that. If I don't wear a mask, it's just a mutual respect that we each do our homework, we educate ourselves, we know our family, we know our situation, we know our children, whether we're at work, whether we're at home, at school. We need to respect each person and their decision to wear a mask or not. That's really the gist of the bill.
So is that what this bill does?
The bill is not supposed to discriminate against anyone who chooses
Doesn't
not
say
to wear a
anything in
mask.
there about not discriminating.
The intention of the bill says that to, let's see, right up here in 15.2-2, it just talks about notwithstanding any contrary provision of law, general or special, no locality shall adopt, implement, or enforce any policy, rule, or order related to COVID-19. We're just trying to cover all of our bases, and so that's why I specifically asked them to have a specific rule in the actual language of the bill itself. In section 15, we say no locality, talking about when we're in public places. Starting in section 19, we're talking about private and public schools, so not just the public schools, but the private schools. In line number 24, we're talking about our public and private colleges and universities. And then in line 29, we're talking about employers. So it's trying to be comprehensive and specific, that basically we're not going to discriminate against anybody who chooses not to wear a mask. And Madam Chairman, if I could briefly just share a personal account. You know, I have
Let me get into public testimony first.
Sure, absolutely, I respect that.
Are there those who are here to speak in support of Senate Bill 458? Okay, come forward. You got 10 minutes on this side for those who are in support.
I wasn't even planning on speaking, but now I just feel like I need to, so. Okay, just in support of the bill, I wanted to say,
Please state your name.
my name is Emily Klein. One of the things that I keep coming back to, and kind of with what y'all just were talking about, whether or not it was discrimination and whether or not you should be able to do this in a business. Should we be able to say that? Well, so when we go to something that has no factual backup, there's no data. The CDC has provided me none. The VDH has provided me none. There is no conclusive data that masking universally prevents the spread of a virus. And those that believe otherwise have mitigation strategies they can put in place for themselves. But when I talk about why we're doing this in school buildings, because I do have school-age kids, we look at nobody that is implementing this can provide us with any proof or any data. And so if my boss told me to go steal a car, am I still liable, or do I just put that up on my boss? So just because the CDC or the VDH tries to tell us to do something, people need to use their brains, right? And what is right and what is wrong, and at some point we have to stand up. So that's how I feel about schools, right? And so one of the things too, and I've done a lot of research on this, mental health. I'm an advocate for mental health. I lost my brother to suicide. It's something that I hold very near and dear to my heart. So to watch these children, and especially these younger children wearing masks, facial recognition studies have been done the 80s, the 90s. This isn't something new. It helps children build empathy, which means they learn how to deal with emotions, right? And how to understand other people. In other countries, when they train children to be a suicide bomber, do you know what they do? They mask. They don't want children to learn to care about other people. And we are depriving our children of this on top of the educational impact. You know, not being able to read and write because you're missing that connection with a teacher. How do you go in with a teacher and feel supported? You can't see them smile. You can't get that reassurance. There's other things. I mean, I've got friends that children have nosebleeds. They have strep throat constantly, the bacteria. But here's the reality of what happens in the school, okay? I walk in the school. Masks are mandated. Front office isn't wearing them. Here's the reality of what happens in a school. Children aren't wearing them properly. Here's the reality of what happens in school. You will never be able to force children to wear a mask properly. You ask the kids that are, and their families are very pro-mask, they wear the same mask for 5 days in a row. So I don't know how that mask that they wore for 5 days in a row has anything other than bacteria in it. So I think it is a personal responsibility to do what is right. I do not want my kids to wear a mask in school. I make sure my kids have 3 masks a day and they are changing it constantly. I know the harms. There are studies out there about the bacteria. There are studies, numerous studies that wearing a mask for that extended period of time is detrimental mentally and physically. So we can't control what other people do, right? We all can take the data and make our own decisions, and I think that it is everybody's right to do so. Thank you.
Thank you. Anyone else want to speak in support? Those in opposition?
Madam Chair, Committee, Vicki Kitts with the Virginia Education Association. We oppose this bill. Thank you.
Thank you. Anyone else? Okay, so we have Senate Bill 458.
Madam Chairman, I propose an amendment, and without this amendment, I can't support this bill. And that would be strike all of lines 28, 29, 30, and 31.
To strike 28 through 31.
Which is the part dealing with forcing employers to not be able to run their own business the way they want. Seconded, yeah.
I mean, his is an amendment.
We have that for lack of
Okay, I understand where you're coming from, Senator Chase, but as somebody with an immune compromised system, you know, I have the same rights and freedoms as everybody else who doesn't, if you don't want to wear a mask, you know, fine. But I don't want people in my presence, you know, who feel as though your freedoms are more than mine, you know, or your rights and your liberties are more than mine, you know. And that's the sense that I get from individuals who feel as though somehow I don't want to wear a mask, and I don't want to be, you know, I have that right more than somebody who wants to wear a mask.
Madam Chairman, I completely agree with you, and I would tell you that I have a note from a neurologist saying that I cannot wear a mask, even if I wanted to. And so I think we, as people who both share situations, that we just have to show love and respect toward each other and understand that by my not wearing a mask, it's not to disrespect you, and vice versa. And just that mutual respect and agreement that we respect each other's decision. And I know when I walk on an elevator, if I see people in there with masks, I'm like, are you okay with me getting on the mask out of respect for other people, for you and others? So it's not a sign of disrespect. It's not a sign of disregarding other people's concern. I mean, everybody has their right and their choice. And I think it's just a matter of how do we as a society come together and out of love and respect toward each other and live and work and go to school together and play together and respect these differences, because we all have very strong feelings medically and otherwise. For me medically, and I know some of the other people, if you remember the executive order, originally there was an exemption for people who had disabilities. I deal a lot with domestic violence victims who have been strangled. And I've had two of them to tell me that they were denied goods and services because they could not put on a mask and walk into a store. It just brought too many terrible memories because of the strangulation. So I'm just very sensitive to different groups of people that I've been in contact with, that for them it creates PTSD just to wear a mask or put anything on their face at all. I'm just sympathetic to those folks as well.
And I understand.
Yeah.
Do we have a motion?
Madam Chair, I move to pass by indefinitely.
And I'll second that motion. The motion is to pass by indefinitely Senate Bill 458. All those in favor, please say aye. Or to recommend to the full committee. All those in favor, please say aye. Aye. Those opposed? No. Okay. Thank you,
Right, thank
Senator
you.
Chase.
Thanks for listening.
Senator